Welcome back to Medicine Made Easy. I'm Dr. Ganoni. Today we're discussing a potential game changer, the ARISE trial. MAC lung disease is a serious treatment challenge, especially when standard initial therapies are limited. The 2020 national guidelines only recommended adding ALIS after 6 months of guideline-based therapy had failed. Back then, there was a lack of supportive clinical evidence for its use in initial treatment regimens. Now, Daly and colleagues have addressed that evidence gap with the results of the ARISE trial. Investigators randomized adults with non-cavitary MAC lung disease to receive ALIS, or empty liposomes. Both groups received a daily base regimen of 250 milligrams of azithromycin plus ethambutol. The median age of the 99 patients was 69 years, and nearly 78% were female. The study had a global reach, enrolling patients across the Americas, Europe, Asia, and Oceania. Half had bronchiectasis, 21% had asthma, and 16% had chronic obstructive pulmonary disease. Infections were primarily due to Mycobacterium intracellular and Mycobacterium avium species. By month 6, culture conversion occurred in 80.6% of the ALIS group versus 64%. By month 7, the difference was even more significant, with a nominal p-value of 0.0010. The median time to culture conversion was just 1 month with ALIS, compared to 2 months in the control group. Among those who converted, only 12.8% had recurrent infection, compared to 50% in the comparator. Crucially, there was no instance of emergence of resistance to any of the treatment drugs used in the study. 74% of the ALIS group who were culture negative at 6 months hit that goal by the first month. Safety is key. 11 ALIS recipients discontinued early, mostly due to side effects, compared to only 4 in the control. The most frequent adverse events in the ALIS group were cough and dysphonia, or voice changes. By contrast, cough occurred in only 3.9% of those receiving the empty liposomes. The investigators also measured patient-reported improvement using quality of life and fatigue scales. Respiratory improvement plateaued for the control, but continued in the ALIS group through month 7. It's worth noting that the 2-drug-based regimen used here differs from the standard 3-drug recommendation. Evidence suggests rifamycins may add more toxicity and drug interactions than actual clinical success. Overall, the ARISE study provides strong evidence that adding ALIS to initial therapy provides clear benefit. This data seems sufficient to warrant an update to our current national treatment guidelines for MAC. A rigorous cost-benefit analysis will be an important next step as we look to adopt this approach. The ARISE trial effectively closes a critical gap in our clinical knowledge for treating non-cavitary MAC. We are seeing a shift toward more effective, targeted initial therapies for our patients. Thanks for watching. I'm Dr. Ganoni. Stay informed, stay healthy, and I'll see you in the next briefing.